It was a disaster that's already caused 2,000 deaths, a horrific human tragedy, according to the peer who led the inquiry into the use of contaminated blood products by the health service. The worst treatment disaster in the history of the NHS, says the doctor, Lord Robert Winston. The independent inquiry reported today, with the authors accusing government and scientific agencies of taking far too long to recognise the dangers of hepatitis C and HIV in blood imported from the US in the 1970s and 1980s. Our political correspondent Victoria Macdonald reports.
They had waited so long for this inquiry into blood contamination, the haemophiliacs infected with hepatitis C, HIV or both, and the families of those who have already died. It was, according to Lord Archer of Sandwell, a horrific human tragedy.
A full public inquiry into this issue should have been held much earlier to address the concerns of the haemophilia community. The procrastination in achieving national self-sufficiency to avoid the use of high-risk blood products from overseas had disastrous consequences.
He said it was pointless saying who is to blame, though it was hard not to look for culprits. The threat of disease was known in the 70s and 80s, and there were suspicions about the blood imported from America and taken from the likes of drug addicts. Yet the report authors were dismayed at the time officials took to respond. Matt Gregory had come from his home in Derby today to hear all this, to hear the reasons why he is HIV positive.
We knew that there were problems, but we were always led to believe that they were unavoidable or just, accidental and nothing could have been done about them. But with the Freedom of Information Act, we got so many documents which led us to believe that people had misled us horribly. An apology would be nice, but who's to apologise? There's so many people involved, from the pharmaceutical companies all the way down the line. An apology would almost be meaningless now.
The numbers affected are stark. Of the 7,000 haemophiliacs in the UK, more than 4,500 have been infected with hepatitis C. More than 1,200 were also infected with HIV, and nearly 2,000 have died. And now there's the spectre of variant CJD. Last week it was announced a post-mortem had indeed found the disease in the spleen of one haemophiliac, though it wasn't what killed him. What has caused so much anger and such a sense of betrayal is the refusal of successive governments to hold their own inquiry into the contamination of the blood. The view has always been, we know everything that there is to know. But what this inquiry came up against was documents that had been destroyed or blacked out or quite simply withheld. And officials at the Department of Health here refused to participate. Today, Lord Morris, who instigated the inquiry, finally took hold of the report.
It's pointed out, of course, that people who were terminally ill crossed the country to give evidence here at Westminster to this independent public inquiry. And it's pointed out that people here in Whitehall were not prepared to cross the road.
The Scottish Government has announced a statutory inquiry, but here ministers would only say they are studying the recommendations, which include ensuring financial help is given to victims and their families, and that effort is put into identifying those infected, but who may not yet know it.
Victoria Macdonald reported.